Male pattern baldness, it's a very sensitive topic, especially for men, And I think they accept it very graciously and they handle it very graciously, but I don't think any man wants his dome to be pointed out at or paid attention to, unless he really loves it.
Well, I think also one of the issues that young men have to deal with is having male pattern baldness when you're young. I think that's a very difficult issue to it. But a series of guests who'll be informing us about that and some of the reasons of why you might have that particular condition, a hypothyroid, genetics, hormones.
There's a variety of reasons.
Yeah, I mean, abrasion to the head injuries. I don't know. You know, the list is sort of like this long. But we're going to have a look at all of them and answer some of those questions.
Right now, we have three very brave men not on the set with us, but they are in the form of a segment, and they're openly and honestly speaking about their experience with their receding hairlines right now coming up on your screen.
The First Blast managed to conduct a survey with three very endearing bald men.
It's a standard process, I would say, going into denial and then accepting it. I've accepted it, and I think it's a good feeling.
I think I like it. It's not a problem, but I think because it's got to do with the shape of your head as well.
I feel good, I feel normal, I feel great. At times I look at myself, you look.
There are no such standard response that you can actually look forward to. There are certain people who say, oh wow, you are just looking so good, get rid of every hair that you have. And then there are some people who are saying that you should think of going back to your hairy days.
I think initially when I think I was in college or something, it felt a bit weird. But I sort of got over.
कभी-कभी पीछे से आवाज आती है गंजे, but then who cares? But other than that, no, I think कुछ लोगों को सूट करता है, कुछ लोगों को नहीं. I believe I'm lucky that it suits me.
I'm happy. Bald's good.
Not at all. As I said, I like it the way I am.
Well, we're talking about male pattern baldness today, and it's of great concern particularly to younger men. But we have on set with us today Dr. Zulfiqar Tunio, and he is, and thank you very much for joining us, and he is a hair cosmetic, I beg your pardon.
Cosmetic, plastic and hair restoration, sir.
Thank you so much for being on the show, Dr. Tunio.
Thank you.
Dr. Tunio, we'd like to ask you the first question being the definition of male pattern baldness.
Male pattern baldness is a condition in which there is a receding of a hairline in a male in a specific way, that there's a M shape. You can see, it's a start with. And the hair in the front, they are certainly different from the sides. They are fine, wrinkly, and it's progressive in nature. So certainly there's a broad forehead, and sometimes it affects, or it starts with the crown as well. So being a progressively, it affects the frontal part and the vertex and crown.
Dr. Tunio, tell me, what is the the age of onset for male pattern baldness?
Majority of the people, which suffer from MP, male pattern baldness, are in age of 20s. It starts in teens and affects shows the results, shows the effectiveness in 20s and then
manifests itself in the 20s.
It's making me very curious, and I'm wondering, is a male hair follicle different? Because there's no such thing as woman pattern baldness.
There is.
There is,
yeah.
Really?
But it presents differently. In female, what happens, there's the presentation is in form of a thinning rather than a complete loss like a
we never
male.
go bald.
I have seen though, very
few,
rarely.
Rare.
Yeah, very, very
It's
rare.
common in men.
Yeah, it is very, very common in men.
Right.
Do you have any data on that off the top of your head? What percentage of men go bald? What percentage of men have this condition?
If we look at the 20s, about 2 to 4%.
Okay.
And if we look at the age of 50, then nearly 60% people are the bald.
Really?
Yeah.
It's as much as that?
Yeah, it is.
And
certainly.
it's a sensitive topic for men.
So
Would you
very
agree?
sensitive. Very sensitive.
Do you think that, I mean, I know baldness affects men. It would make me feel uncomfortable if I was bald. I wouldn't like it. But presumably it must have an emotional and a sort of psychological impact on younger men when it happens.
Well, it varies from person to person.
Oh, okay.
And I have seen very devastating effects, especially on the young individuals,
Sure.
who are students and progressing in a career. They go and isolate themselves, and they are really suffer a lot. They can't present in a proper way.
But why is it that men experience male pattern baldness? Why does this happen to them?
The medical is, once fetus is within the womb of mother, there's a shift of gene from father as well as mother. you know. So in a specific area, when male loses the hair, the receptors, the follicles, you know, there are receptors on the follicles, roots. These receptors become sensitized with one of the hormone, male hormone, androgen, that is called dihydrotestosterone. So at the age of adult, when there's a change in the hormones, you know, so these hormones go and stick with these follicles or roots, bring the miniaturization changes in these follicles, and the growth pattern is altered.
And is it hereditary?
It is hereditary.
It is.
But it is not only simply hereditary, you know. It will be, both of the factors should be there, hereditary as well as hormonal change.
Okay.
This happens, you know, you might have seen a person, 4 of the brothers in a family, 2 are bald, 2 are not. 2 are having a gene, but there's no change in hormones, so they are spared.
We just come to a, I don't know if we should call it a common myth, but there are some men who will say that it's the water that's making their hair fall, or even women. You know, it's all in the water. My hair is, I've got lovely hair, and the water is
let's
bad.
have a big massage and all come back,
But
you
there are a
know.
lot of fallacies regarding the hair fall.
Is this true?
There are a lot of fallacies.
Hard water, soft water.
There's no any scientific foundation for that. There's no scientific foundation for a change because of water, because of shampoos, because of a change of weather, and because of a lot of other things, you know.
Has research been done where they've used hard water, soft water, mineral water to wash hair, and
It doesn't make any
it doesn't make a difference? Dr. Tunio, more and more men seem to be losing hair at a much younger age, and earlier on we had shared a segment with all of you which was on, for lack of a better word, 3 bald men. You know, no offense to any of you, but we showed them, and we're wondering whether it's a change in, I mean, there's global warming and there's environmental changes. Is this, what is affecting,
And
or
also-
are men using hair at a younger age? Are there,
And I want to add to what Shazia is saying, and just give it a slightly different dimension. Is that just because we're living longer, so it manifests itself more?
Certainly the incidence of a baldness is increasing even in the younger age group as well. Why is this happening? You know, there's quite ambiguous things, you know, which are going on probably. Scientific reason is the 2 of the reasons, you know, they go side by side. One is genetics, another is hormone change. There are certainly other reasons as well, just as autoimmune disease.
Yes.
You know, they play a part, and there's a patchy loss. You might have seen quite a common in Pakistan as well. That is
alopecia.
Alopecia areata. Some radiations, you know, somebody getting treatment for the radiations.
sure.
Somebody getting a treatment for the cholesterol lowering agents. These are blood pressure medicines, you know. These are the reasons for the hair loss as well.
And presumably with all this global migration and so many people marrying from different parts of the globe, would that somehow influence that, and you'd have a greater pool of people going bald? I don't know. This is just a...
One of the factor, you know, because of close marriages in
Yes.
in families, you know, that could be one of the reason. But even if the gene is not present in father's side and gene is present in mother's side, it presents in the same way.
Now, coming to your profession, how effective do you think hair transplants are?
I think it's I'm playing a very, very good, you know, part in the society if I'm doing hair transplants over here, because I'm giving them happinesses. The people come and give a comment like, "Sab, I didn't see the mirror for last 8 years, believe
Oh
me."
dear.
And
gosh,
now I have
really?
started to like myself, love myself, starting to clothe in proper way. So that is basically self-esteem, which increases because of
Aside from the hair transplants, are there other remedies or other cures that people
Yeah.
pursue, that patients pursue?
There are other non-surgical methods as well, just as hair pieces and
Oh, I see
wigs
that
and
way, right, okay.
There's no other method.
other camouflage, you know, and of implants, you know, filaments, that is synthetic hair.
Does that
These are
hurt?
things, you know.
Does that hurt?
These have been worked, you know, in past, but now nobody is getting filaments nowadays.
Do hair transplants hurt?
Yeah, that's what I was asking. Do they hurt? Are they painful?
Hair transplant, you know, hurt certainly. I mean, it's a procedure and it's a surgical procedure. We just as you go for dentist, you know, dentist stick a needle inside and freeze the area and then work. It's the same way as we try to make the patient very comfortable and use the finest needle on the earth.
So if you've passed the crown and vortex, how many injections do you need?
So I can't tell you. You know, nobody's going to come to me if I tell you the number of injections.
Oh,
Many.
dear, really?
Oh, no.
Certainly many. But once we give a nerve block, nobody's going to feel the pain.
Oh,
And
so
they're awake.
Okay.
Only the 2 needles. That's it.
Okay.
And they're awake.
Yeah,
And
they're
is-
awake, aware of everything. You know, going for a lunch break, dinner break.
Oh, we get a hair
refreshments,
transplant and go back to
yes,
work.
It's a total outpatient
They're watching telly
procedure.
most of the time.